Vivek, please.
Thanks. Andreas, that was great, and I really appreciate the way you've crystallized the distinction between the two. I certainly agree with everything you had to say. I think in the spirit of the history lesson that today is, it's worth reflecting on the origins of ISIS, which were not talked about this morning, and that's something known as the, I think it was either the Scott Task Force or the Scott Commission, Graham Scott. In the previous OMA ministry deal to the one that got ISIS established, the Scott Task Force has been created, and David and Jack and others in the room actually provided the research support for that task force, and it was all about diagnostics. Mm-hmm. And so it's back to the future.
It was cholesterol testing, wasn't it? Is that the one?
Yeah, and David has a few scars from the cholesterol. These are still here, he could show them to you. And so it's interesting to sort of reflect that we actually start, the concern around appropriateness is always starts with lab testing or diagnostic imaging, because that determines so much further utilization. But it's probably the hardest thing to do research with, because you need so much more clinical information. So I think I just want to agree with everything that you say. And my organization provides public health laboratory services, and I can say we don't have the kind of health services research to support the decisions that we make around the funding of the different tests that we do. And it's fascinating for me to sit here today and listen to all this and realize that what I'm now responsible for doesn't actually have the same basis in health services research that many of the other aspects of the health system do.
Maybe I'll just make one comment, Vivek, which is, I made a call for better databases, and you just said we needed richer information. And I'd just like to label that my sense is that even when we have the best information we possibly have, there's still going to be a lot of value-based decisions about, is this an appropriate use of a diagnostic test or not? And I think we need to think about this in I was just fortunate enough to get a Canada Research Council chair in health policy and citizen engagement. And one of the things I would love to do is actually do a kind of citizen dialogue, deliberative dialogue with citizens to say, present them with the data and say, are you convinced that maybe some tests are overutilized? And if you are, help us figure out how to tell the rest of your citizens how to think about diagnostic tests. Because it's not surprising, actually, in this kind of cash-strapped system, that when you say to a patient, well, I actually don't think you need an MRI, that one of the things that just passes through their mind is, well, maybe they're saying that because they're wanting to save money, right? And so I think we do need to, it's not just going to be the data, is my point. It's going to be a much, much kind of broader issue.
Our last question, David. David Henry?
Yeah, Andreas, do you think we should start by looking at screening? And my reason for that is that certainly surveys we've done, I think they're reflected in other work, that the way that screening tests are covered in the media and have resonated in the community in discussions is probably a lot better than has occurred with other diagnostic tests used for diagnostic suspicion of disease. Controversies have played out quite extensively. We found the media coverage to be reasonably good compared with other diagnostic test stories. And also overdiagnosis leading to pseudo-disease and so on has played out and is really important, quite impactful. So given the difficulties you've highlighted, I totally agree with all that. Is that where we should start a further study?
Yeah, it's a good question, David. The honest answer is I don't know. There is a task force in the periodic health exam in Canada now that's headed up by Marcello Tonelli, a nephrologist in Alberta. The first guideline they decided, I think they're kind of wishing they didn't choose that one as the first one, actually, David, was mammography. Actually, from my read of it, they actually didn't make that many controversial recommendations, actually. But oh my God, the shit hit the fan kind of big time, with them being attacked from every side. They recommended a slight decrease in the frequency of mammography. Frankly, a lot of the breast cancer advocacy groups went after them, and it just became this incredibly, at least from my perspective, kind of non-evidence-based kind of bun fight, and I think we probably need to be engaged more in that. But I guess the point of that story is just that it ain't going to be easy. And around the PSA thing, I was just in a meeting in Alberta where actually an oncologist was getting up saying, we've got to convince the public that actually screening for PSA almost doesn't make any sense whatsoever. But at the same time, they were talking about a thing that was held at the Rocky View Hospital a week ago with all the Calgary Flames saying you got to go out and get your PSA tested, right? So even with screening tests, I think there's a big uphill battle.
Well, thank
But
you
I am
very
positive.
much. Excellent.